Okay, a metatarsalgia case study. We're on the front page of mackenzieorthotics.net. To get to the orthotics builder, the most direct route is using this link right here under the resources. And here we have the orthotics builder page. So let's get going with our case study. We have a 50-year-old, 150-pound female hairdresser who walks daily for exercise. She has developed bilateral forefoot pain, including numbness and tingling with walking and standing for long periods of time. She says it feels like she's walking on marbles when she walks. She's tender on palpation over the third and fourth metatarsal heads and the spaces in between the metatarsal heads. That's between 2 and 3 and between metatarsal heads 3 and 4 as well. Fat pads under the metatarsal heads have thinned, and she has high arches and is supinated throughout the gait cycle. Forefoot valgus was noted as well during her non-weight bearing assessment. So if we are going to build orthotics for this patient, what we need to do is fill out the form here. And need to start with an account number. If you do not have an account number, you can get one here. You need to apply and be approved, and once you have the approval, we will send you an account number, and you need to use that in order to get any orders filled from this site. Okay, this is just a fake account number we're using for the purposes of this demonstration. So for the shell, for this patient, we will use a soft shell. Now this selection I'm choosing here, you may have two selections that I'm working right now with my manufacturer. We may have another selection for the soft shell. Right now we just have one option, and if we do, it'll be self-explanatory which one you would use for this case. I tend to go with the soft shell with any high arched supinated foot because I have found in my experience that the softer shells work better for patients who have a more rigid high arch supinated foot. It is perfectly okay to use a regular shell with this, and the regular shell is slightly less expensive, and it will work well, fits in shoes a little better. I just find I ended up getting better results over the years using a soft shell with these type of patients, as long as you know they have a shoe that it'll fit in. Okay, top covers. In this case, she is a hairdresser. I'm going to really try to make sure that she wears reasonable shoes while she's doing her work, standing on her feet all day. But in order to do that, we still are going to want to go with a little bit thinner top cover. Instead of the 1/8, we'll use the 1/16. It'll fit in more shoes, give her more options. Bottom covers, we'll just put a vinyl bottom. Keeps it thin. The puff, the microcell puff, have a fairly good cushion, and should do the job, especially with the soft shell. So we'll put a vinyl bottom cover. It'll help protect the bottom of the soft-shelled orthotic as well as stabilize the forefoot area, makes it slide in and out of shoes a little better, makes the orthotic last longer if you do use that bottom cover instead of leaving it off. Okay, metatarsal pads. So we do have metatarsalgia in this case, so we're going to want to use met pads on both. If you had it on one side or the other, you have the option of choosing just one side or the other. Heel pads are unnecessary. Arch pads, none. Heel stabilizers, none. Extensions. Now we did say she had a forefoot valgus deformity bilaterally. This works well for forefoot valgus. It's a 2 to 5 extension. If you look down below here, you can really see a good picture of it. It runs in underneath the metatarsals 2 through 5, leaves a little bit of a space for the first metatarsal head to drop in. If she's a supinator, it encourages the weight to move medially for toe off, and it also accommodates for that forefoot valgus deformity. Okay, rear foot posting we do not want. Just be really careful with the supinator that you do not put any varus posting, because it'll push them more into a supinated position, especially the rear foot. There are some rare cases where you can use varus posting with a supinator, but they're few and far between. No forefoot posting. We use the 2 to 5 extension in its place. And shoe size, we didn't establish that, but we'll say she's a 7.5. And that's all there is to it. We just built a pair of orthotics for this lady. What they will look like is a combination of this top cover. Okay, we'll have a metatarsal pad. The arch is built into the shell of the orthotic, and this would be what the cover looks like. The shell is a soft one, so it'll be this type of shell. It does take up a little more room in the shoe for that, so according to her shoes, we may have wanted to go to the regular shell that looks just like this. But for the purposes of this demonstration, I'm going with what I feel would work best, assuming that she is going to agree to wear the shoes that it fits in. Once you're there, you just go to Add to Cart. It runs through the options that we chose. This one came to $94, and that's all there is to it. As you go through, you can continue shopping to go back and make another one for a different patient, or you can check out, fill in your information here, and follow up through to the credit card page and order the product. That's all there is to it. If you have any questions, then feel free to contact me. The phone number is here. Make sure you leave a message if you call that number. And down in this area, there is an email contact form. We do return emails. Again, be patient if it's a couple days before we get back to you. Usually we're pretty good, but if things are really busy, sometimes it does take a couple of days to return messages. And that's about it for now. Hope that was helpful, and hope you have a wonderful day.